As COVID cases spike across the country, a big question many people have, can you use expired tests that have just been sitting under your sink, perhaps?
Right. Some of you may have them at home right now. Andrew Pekosz is a professor at the Johns Hopkins Bloomberg School of Public Health and joins us live. Thanks for joining us today here on Houston's Morning Show. What would you say the risk is of using expired COVID tests?
Well, the biggest risk of an expired test is that you would get what we call a false negative, meaning you're positive, but the test isn't working right. So the test tells you you're negative, and you then go about your business and perhaps spread the virus to other people in your workplace or at home.
Well, that's definitely not a good thing, so I guess we should keep an eye on that. However, the FDA has actually extended expiration dates on many tests. How do we check for that?
There's two ways you can do that. You can go to the FDA COVID test website, and they have long list of companies that are making COVID-19 tests. You can find the lot number of the box that you have at home, and it will relatively quickly tell you whether or not that test has had an expanded lifetime. You can also go to the manufacturer's website because they often have that same information there, which might be faster to find.
Doctor, there's been a lot of talk now that COVID is on the rise again about these variants and how well they can be detected on at-home tests. It's evolved so much. How do you feel these at-home tests do against the new variants?
Well, one of the important things to know is that the manufacturers making these at-home tests have a really good idea of what parts of the virus the test detects. And so as soon as we see a new variant and we have the sequence of it, those manufacturers can look and say, yeah, my test will recognize this. Or in a worst case scenario, they can say, I have some questions about whether my test can recognize it, and they can go and get the vaccine, get the virus, and actually do those tests. So for the at-home test, there's a high confidence that they're working against all the currently circulating variants here in the United States.
Oh, that's good to hear. It seemed like before almost every single employer required you, though, to go get a specific type test at an urgent care or at your doctor's office. Do you know if that's still the case, or are more people just accepting, hey, you got COVID because it has become so prevalent?
Yeah, I think we're seeing a time when individual companies, individual workplaces are coming up with their own rules based on how much risk there is to their employees. I always separate out things like, you can imagine a nursing home or a hospital would have slightly different standards for masking and testing than, for instance, maybe a supermarket. So it's really about the company and the environment that they're in now. I would not be surprised if you start seeing companies suggest wearing masks and people taking COVID tests, because cases are increasing, and COVID really is a dangerous disease for many parts of the population.
All right, Andrew Pekosz, thank you so much for coming on Houston's Morning Show. Have a great day.
Thank you.